My name is Emily Schreiner, and I'm a project coordinator at the Wisconsin Institute for Public Policy and Service, or Wipps. On behalf of Wipps, as well as the Center Right Coalition of Wausau, I would like to welcome you to tonight's event, the HOPE Agenda, addressing the resurgence of heroin in Wisconsin. We have to say a quick thank you to UW-Marathon County for allowing us to use this fabulous room this evening. You should also already know that we are recording the event. DVDs will be available from Wipps, which is in the building across the street, the Center for Civic Engagement. If you'd like a copy, those will be available in about 2 weeks. We also have to say thank you to Keen Winters for organizing tonight's event. Keen operates and owns the Great Lakes Financial Management Group. He also serves as an alderman for Wausau's 6th district, and tonight he's representing the Center Right Coalition. So now we will get right down to it. Our speaker, State Representative John Nygren from the 89th Assembly District here in Wisconsin, which is over near Green Bay. And as we know, he has been a very strong voice for drug reform in our state. So welcome, John.
Thank you. Well, this is, thank you. I'm not really accustomed to speaking about this topic other than maybe in a political environment. And even that has been, over the last few months, something new for us, because as a family, we have dealt with the struggles of my daughter, who is 24 years old. Her name's Cassie. You'll probably hear that name a few times privately for the last 4 years, just like most families would. But the reason I decided to step up and be a voice was when I began to see how significant this problem was for my friends, my neighbors, my community. I grew up in Marinette, Wisconsin, population 11,000. We got Menominee, Michigan right across the river. Graduated Marinette High School in 1982. Never heard or imagined of having heroin in my community. Sure, there may have been some marijuana, there may have been some drinking parties, but heroin was just not something that you fathomed in small-town Wisconsin. As a matter of fact, our district attorney says he didn't have the case of heroin between the 60s and the year 2000. Did not have one. But unfortunately, it's a different world we live in today. And just to give you a little bit of background on our situation. My daughter, as I said, 24 years old. I learned in 2008 that she had an addiction. 2009 that she had an addiction. And I remember the day she told me. We were at a pizza place, and she told me of her addiction. I think I literally was sick to my stomach, because that's just not something that any parent ever expected to have happen. But things started to add up a little bit, I think some of the challenges we had been through, from a straight A student in middle school and high school, up until about her junior year, to a girl that wasn't going to school anymore. Unfortunately, she had a boyfriend's family who enabled her to stay there at night, which left her mom and I kind of struggling for any type of parental control. We went to the police department, we went to the school, we went to the human services to try and get some parental control back, but because she was over 17, there was really very little they could do, so we were really on our own to try and pull her back, and we tried a lot of different things. I remember taking her car away, taking her car and locking it in a storage unit somewhere in town where she didn't know where it was, to try and think that maybe if we controlled her transportation, we'd get some control back on her. I mean, that was just one effort. There was a lot of others. So the reason I tell you that story is because I think a lot of parents think that, it can't happen to them. While her mom and I were divorced at an early age, she was a child that was loved by both sides. She did have a strong church family on both sides. She had people that cared about her. But unfortunately, as I'll tell you a little bit later, there were some other things that happened to her that probably made drug abuse more likely than for anybody else. But so She told us about that problem. We got her into treatment, and unfortunately, like a lot of folks, treatment failed the first time. Treatment failed the second time. And any parent, I think, who has a child that's going through an addiction or has an addiction, there are not a lot of nights that you sleep pretty easily. You're always afraid of that phone call that could come, because we all know heroin and drugs like it can take people's lives. So while it didn't come at night, that phone call did come one day. And her mom called me frantic, and she had gone home on August of 2009 to shut the windows at her home because of an upcoming storm. And as she was going in the door, some of Cassie's friends were going out the door. And she went into the house, which was empty by that point in time, and found Cassie passed out on the bathroom floor with a needle still in her arm. And she called me. Frantic. I dialed 911, get the folks there. I was at an office close by. I rushed over there. Her mom is not somebody who deals with catastrophe very well, so she was pretty frantic. I went to Cassie's side. The needle was still in her arm. I took it out. She was turning purple. Helped her to breathe, and prayed that the EMTs would get there in time to be able to save her life. Thankfully, Marinette's a smaller community, but we do have both the emergency rescue squad, which is volunteers, and paramedics at our hospital. The EMTs from the rescue squad arrive first, and they are basic level EMTs, meaning they can't administer any type of medication. They're just basically there for basic first aid. Thankfully, the paramedics arrived about a minute later, very quick, and administered Narcan, which is a drug that reverses the effects of the overdose. And within seconds, Cassie came out of it and was breathing again. So thankfully for her, she survived the overdose, but she was in possession of heroin, and because of that, she went into the court system. Being in the position I am, obviously I know the DA pretty well, I know the law enforcement pretty well, and I just said to that, I ran into them at some event one time, and I said, if you guys, because I hadn't heard anything this had happened a few months, and a few months had gone by, and hadn't heard anything back from the district attorney's office. And I said, if you guys think you're doing me a favor by not pressing charges, you're wrong, because we're afraid that this hadn't deterred her from further drug abuse. And I think there's something I've learned with heroin since I became familiar with it. If you're a heroin user, you're going to die at some point in time. It's going to happen, because the purity levels with heroin is different from dose to dose. So you never know when you're going to get that dose that is going to kill you, that's going to take you over the edge. So she hadn't learned from it yet, unfortunately. She hadn't, even the near-death experience had not scared her, so she was still using heroin. Well, our court system, she did finally go to court, and the judge's sentence was for 3 years, which from what I know is pretty strict for simple possession of narcotics. But they also gave her 18 months deferred, meaning that she could be out in basically half of that time. So she came home a year and a half later and reoffended within 2 months. When somebody has a drug offense, then they get out of prison, they come home and they're assigned a parole officer. And that parole officer typically will have a once-a-month appointment with the parolee. And at that point in time, they will be drug tested. That's our current system for the most part. What the drug users have learned, they've learned how to mask the drug test, for example, and they've also learned to take chances basically in between when their next appointment is. So there's really very little deterrent in a lot of cases for them to go back to the culture of drug use. So she reoffended within 2 months, was back in for I believe about another 10 months, and then was released again this summer. And she on July 17th left town. She came back to Marinette, and on July 17th she left town, and because of that broke her probation and was not heard from again until I believe middle towards the end of September, which actually coincided with me taking part in the statewide awareness campaign on heroin and also releasing some bills on heroin. So she is now in the Marinette County Jail waiting a revocation hearing for her parole. So she has 7 months left on that original 3-year sentence. The Corrections Department's plan for her is to revoke her parole and for her to do the remaining 7 months in her original sentence. Which for me, quite honestly, I think is the worst idea possible. And we'll get into that a little bit, but I think it's the worst idea possible. I'd be better, in my opinion, I think it'd be better for her to have a longer sentence and to get out and still have some supervision, because heroin users just cannot, unfortunately, do it on their own. They're going to need some help to be able to break that cycle. So all these experiences that we've had led me to investigate this problem. And as I said earlier, the reason I decided to get involved was when others in my community started dealing with the same problems my family has been, and actually even my business community. Marinette, we build ships, and we have a couple paper mills, we have some heavy manufacturing, we have foundries, we have a pretty strong manufacturing base even still to this day. And prior to the downturn in the economy about 5-6 years ago, we had 200 jobs in our community that were unfilled, just because we didn't have the people to fill those jobs. So still pretty strong, and the community, the leaders of those businesses stepped forward and said, you know what, we can't fill the jobs that we have, and one of the reasons that is because we have such a significant drug problem here. So actually our Chamber of Commerce got involved. Not really an issue that typically the local Chamber of Commerce gets involved with, but our local Chamber of Commerce got involved and created, they have a group called Impact, and it's bringing law enforcement, the court system, the business community, social services together for a task force basis to be able to work together. I think you've got something similar here in Wausau. That was, to me, the wake-up call to say, you know what, you need to step forward and talk about your situation and do something at the state level to help. So we'd never shied away from this issue. I mean, it was always in the newspaper when she got in trouble. Matter of fact, about a year and a half ago, Channel 11 on the Green Bay did a story on heroin in Marinette, and they interviewed us, her mom and I, and we talked about it, but it was not something that I was involved as from a law enforcement, or I'm sorry, from a law-making perspective. But we decided to look into the issue. So there's 4 different bills that we've proposed. And the first one is a 911 Good Samaritan law. And a lot of these are based on the experiences we've had. 911 Good Samaritan law, in Cassie's situation, what would have happened if her friends or if her mom didn't go home to close the windows that day? All likelihood is she'd be dead today. There's stories upon stories statewide where we hear about drug overdoses where the people are found by themselves. Heroin is a very social drug. It's used in social settings, and in most of those situations, they were with friends when they took that dose of heroin. We even had a story in Milwaukee where a young girl was dumped in a snowbank to die. And the reason that this happens is because the users are afraid to dial 911 because once the police show up, they're going to be charged with possession as well. So when we first started looking at this, there were 7 states that had a 911 Good Samaritan law for narcotics. And that was just about 6 months ago. Today, there are 14 states that have 911 Good Samaritan laws. So this issue is very topical, not only in Wisconsin, but across our country. The next law that we're proposing deals with Narcan, which is that drug that can reverse the effects. So imagine if we were in a rural area where the police are the first to show up, and we've got to wait 10 to 15 minutes for a paramedic to arrive to be able to administer that dose. In that case, chances are the person's going to die again. So under current law, only EMTs that are intermediate or advanced level can administer Narcan. We are proposing that we change that to basic level EMTs, which will allow the entry level to be able to administer. We have worked with the Department of Health Services. They are supportive of this effort. And I just want to take a step back also to the 911 Good Samaritan law. We have worked with the State Sheriff's Association, the District Attorneys Association. They are both supportive of that change as well. We want to work within the existing law enforcement and support systems that we have to give them more tools to fight this. We don't want to be doing this on our own. We want their support and their help, and we have that. The next two deal with the prescriptions themselves, prescription drugs themselves. Current law does not allow for clean sweep programs or drug collection programs to collect narcotics in those clean sweep programs. It's happening, quite honestly. It is happening that they're being collected, but the state statutes do not allow for that. So this is just a cleanup to allow for those narcotics to be collected in those drug collection programs. And the final one is at the pharmacy. The pharmacy is, this was brought to us by the Brown County Drug Task Force. I can walk in to the pharmacy. My friend Keen here, who actually is on, I think, a painkiller right now because of his fall from a tree. I can walk, Keen's home and not able to get out of the house. I can go to the pharmacy and pick up his narcotics and go home with them. Now, I would, my situation, I'd bring them to him and he'd take them, but if somebody was nefarious and decided to keep those for themselves, or, as the task force has said, unfortunately, we have a lot of people who are forging prescriptions today, and you walk into the pharmacy, as long as you pay for it, you're out the door. So this would require a photo ID when picking up a narcotic at the pharmacy, class 2 or class 3 narcotic. So very common sense approach to helping reduce the illegal drugs that are on the streets. My daughter's case, her drug use started with OxyContin, and in Marinette, Menominee, we actually had a doctor who was selling prescriptions. He, for profit, he was trying to make some extra cash, and that magnified the problem we had in our area because there was a supply of OxyContin. Well, back a few years ago, he got arrested, went to prison. Interestingly, he went to federal prison for less than 3 years, and he's the one that really is attributed. A lot of this can be attributed to. Around that same time, OxyContin manufacturer decided to change the formulation of the pill because they knew this was happening, that there's a problem. So they changed it from a capsule where you could crush to a gel-coated caplet, I think they're called. So the source dried up from the illegal prescriptions being sold, and now the drug, even if you could get it, was not as effective for the drug abuser. So in addition to that, heroin is pretty cheap, and the OxyContin, my understanding, would cost about $1 a milligram. My daughter told me at her height of her addiction, she did need at least 80 milligrams to get high. So that's $80. And it becomes economic. Heroin is quite cheap. Depends, it's different from market to market, but I think on average $10 or so you can find a source of heroin to be able to get high. Heroin users, drug abusers in general. My daughter, Keen knew her from the time she was probably 3 years old on. Sweet, beautiful, smart girl. Addiction takes over. They will lie, they will cheat, they will steal to get that next high. My home has been broken into a number of times. There's no value placed on anything of sentimental value to the person that's addicted. We've had things that, very little street value, but significant sentimental value that have been sold for pennies on the dollar to be able to feed that addiction. So I live in a rural area of Marin County, and I have a security system in my home. That's just the world we live in, unfortunately. So these bills that we've talked about to this point are just the beginning. I don't think any of these are a silver bullet for the problem that we face. Since we went public with the Attorney General's statewide awareness campaign, and since we began talking about these bills, I've gotten probably every single day 2 or 3 emails from parents. And honestly, this is a sad story for us and for our family, but having read and communicated with a lot of parents, we feel pretty grateful because my daughter's still alive. A lot of parents don't have that same second chance to be able to recover from this. So we want to do anything we can to help, and there's a couple more bills that have grown out of this. One of the challenges we face, and having talked to some of the folks who are fighting this here in the Wausau area, is one of the challenges is, especially in underserved areas or smaller communities, there's very little resource for treatment. So we are working with Department of Health Services to develop some programs, pilot programs, to be able to bring some treatment to underserved areas to be able to help fight this addiction. And in addition to that, a reform on our community corrections system. So I talked about how you would be assigned a parole officer, you get a drug test once a month. So let's just talk about how this current system is working a little bit. We had Chris Herron in the Marinette-Menominee area a couple months ago. Anybody know who Chris Herron is? Former NBA basketball player. He basically lost his career. Ironically, his dad was a state representative in Massachusetts. Lost his basketball career to heroin addiction. He now travels the country speaking to young people and communities about heroin addiction and drug abuse. We had a state community meeting with our law enforcement, our judicial system, our DAs, our sports staff. Parole and probation was there, and he asked the question, how big is the problem? And parole and probation said they had about 80 people that had come into gone through the system and gone to prison over the last 3 to 4 years. And the next question he asked was, what's your success ratio? And the answer kind of astounded me. The answer was 0. Of everybody that they arrested, everybody that went to prison and came home, 100% of them had reoffended within a year and were back in the state prison. My daughter's case, that's pretty consistent with that. As somebody who is responsible for the state budget, I can tell you that that's a pretty shocking statistic, and there's got to be ways that we can do it better than a 0% success ratio. So we started looking at the current community correction system and ways that we might be able to reform that. We looked for other states and see what they're doing. The state of Hawaii and a few others, Hawaii was first. They have something called Swift and Certain. And Swift and Certain is, as its name applies, it's more, rather than having to go through the typical revocation process where after you make a mistake, you sit in county jail and wait for your court hearing, which could take 30 days or longer, or sometimes maybe quicker. Swift and Certain, you come into the system, and if you first of all, you'll have more regular drug tests, and they will be random. You'll be issued a color, and they'll send you a text message every day, and the color today is yellow. And if your color is yellow, you will have 24 hours or less, I think even less, to show up and be drug tested. If you test positive, you'll be taken in immediately to the courtroom, and you will be given some type of punishment for that, 3 days in county jail perhaps. If you miss your appointment, you might be given a few days in county jail. The punishment is swift and certain. Just like as a parent, the punishment for a child, if you wait a week to give them the punishment for the mistake they made, it isn't as effective. So this is, in Hawaii, they've implemented this, Rather than right away revoking them and sending them back to prison, they're giving them punishments for the missteps. Their recidivism rate is down 75%. So we are looking at a reform that would implement swift and certain in Wisconsin to be able to help people through the process of addiction. I talked about the state budget. We spend $31,000 a year for a man in state prison. We spend $41,000 a year for a woman in state prison. There's dollars obviously associated with any change we make, but the states that have implemented these changes are seeing savings to the overall cost of their corrections programs. I'm a conservative Republican, you know. The budget, a balanced budget that spends less is important to me. I think that this is a reasonable approach for us to things for us to look at, especially when we have a 0% success ratio with our current system. I know that there's long been the lock them up and throw away the key mentality. You know what? And if you support that, you're supporting that person for $31,000 a year ongoing. If we can break this cycle of addiction, and a lot of the folks that are in our prisons are there because of the addiction, this can actually save us money in the long run. As we move into our society gets older, and as our workforce shrinks, which is happening, we need to help get these people break the cycle, or we're not going to have the level of support or the level of a workforce that we need to be productive in our state. So I think these are reasonable steps. The support to this point has been amazing. Of course, you're always going to run into somebody who may not agree with you, but I think for me, to this point, it's probably been 9-1. For every 9 people that are supportive, there might be 1 person who's against. So I think it's been very good. I think it's a reasonable approach for us, and this is just the beginning, because as we learn more, as we get more ideas, none of this is going to completely solve the problem, but they're incremental steps that we need to take to get us on the right track and to help people break this cycle. So I think it's something that is long overdue, and we're going to take those steps. So that's a little bit of the basis for us and how we got there. I will just say, in addition to the dollars we're spending on incarceration, a lot of the folks that are suffering from addiction also have other mental health issues that they're facing. Unfortunately, for my daughter, I didn't know all of them at the time, but they're either suffering from some mental health issue or trying to cope with past tragedies and traumas. And I just have learned within the last year of some of hers. And you know, when you're sexually abused as a young child, I can't imagine, as a parent, it makes me angry. It makes me sick to my stomach, but I guess that's something that none of us should have to go through life dealing with. And if you're never given the support and the help that you need to overcome that because you were afraid to speak up, I guess it's probably not a surprise that some type of addiction takes place. So that's pretty common with the folks that we're dealing with in the addiction community. So I think it's a compassionate and I think it's a conservative approach for a statewide problem. With that, I'll open it up to any questions we might have. Yes, ma'am.
You said there's a ratio of 9-1 or 1-9. The 1. What?
That might be against.
Like the steps that you're taking are just logical and positive steps. Are they clueless? Would it be because they really haven't had the experience that you have?
I think that's part of it, but I think it's changing. I think if we would have did this 10 years ago, it probably would have been more 50-50. In this room, I mean, what is there, 20 people, 25 people in this room? How many people don't have a family member, don't have a neighbor, don't have somebody at church, don't have somebody you work with whose family has been affected? I mean, just think about it for a second. My guess is almost everybody has somebody that they know, either as a relative or a close associate. And when it becomes personal, it does change your perspective. I was always a pretty, law and order guy, and I still am. But I think when you look at what our outcomes are, it's pretty reasonable to be taking a look at some other options than what we've always done. Because what's the old saying? If you always do what you always did, you always get what you always got, right?
Do you see any initiatives taking place on stopping this supply?
I was asked that question at a newspaper this week, and I've been focusing more on the other side of it, not on the law enforcement side. I think the best way to address the law enforcement side of it is reduce the demand for the drug. I mean, that's my perspective. I know there's some law enforcement people maybe they have a different perspective, but if you reduce the demand, and by reducing the demand, you're reducing the profit, then we'll have less of a problem. Yes, sir.
The Marathon County Board has taken a stand trying to address our jail population through recidivism reduction. And one of the concerns that we have when we start looking at the jail population is that we continually deal with these people that reoffend and come out of the prisons and are dumped back into the community. And you've got a proposal initiative for swift and certain. What we perceive needed in that transition from prison to the community is a discharge plan. And one of the things that's missing in prisons is treatment and treatment plans. And all of the population, they start out in the county jails, and we do an assessment in Marathon County, everybody looking at their criminal logic tendencies, their history of offenses and other things. But alcohol, drug abuse is one of the number one issues or underlying circumstances that leads them into the judicial or the system, the criminal justice system. The concern is that at the point of discharge, they may be treated in a prison, and sometimes they're not. There's a disciplinary action. Sometimes treatment is denied, which doesn't make sense. But they're dumped into the community, and we have repeated cases where people have come back in. Before they even get to the probation and parole officer, they may reoffend and they wind up right back in. It would make sense to treat prisons like hospitals. And in such a way as when they come in, we identify what their needs are, and there are certain people we can never help. But they ought to do a discharge plan 2 to 3 months before the discharge of somebody from prison. These are people that are in for over a year. Work with the community, share those medical records with in this case, the North Central Health Care facilities or other providers in the community to allow them to, once that person comes back, begin treatment immediately, not 30, not 60 days later when they may have already reoffended. But the prisons don't seem to have the capacity to do that. And it would just make sense if we're committed to try to reduce recidivism and keep them out of prison, to support them when they come back in.
I don't disagree. I will just say I'm not an expert. I'm not a treatment expert. I am not a law enforcement expert. I guess I'm a parent with a cause at this point in time who happens to maybe have a pulpit to be able to talk about it. But I used the example of my daughter earlier. 7 months, they call it paper. She got 7 months of paper left. She goes to prison for 7 months, gets out with no supervision whatsoever, no plan. What do you think the chances of success are? 0. So it's just going to continue to create that cycle. So that's why we're looking at these treatment alternatives. So there are some successes. I mean, I guess I don't want to be all doom and gloom. There are some steps we've taken already, which I believe are positive. We did double the amount of money that we put in the state budget for treatment and diversion programs. We put money aside for grants for counties that don't have drug courts, which have proven very successful. Nationally, the average for drug courts, which is very similar to what I'm talking about with Swift and Certain, is like a 75% success ratio compared to that 0 I was talking about earlier. So there are some successes, things that are beginning to happen. Which what we're looking to do is be able to replicate those statewide. Inside the prisons, the program in Chippewa is set up much like what you're talking about. The problem is it's full. There's not enough beds. So we need to change the culture of the correction system to, you know, I think right now their viewpoint is, and they got a tough job. I wouldn't want their job, but they look at it, they go, okay, Cassie's Nygren's, you know, she got 7 months left. Which is easier? Send her to prison for 7 months and we're done, right? Or to create a plan to help break that cycle so she doesn't just keep going back and forth. But right now the culture is just, you know, lock them up and it's somebody else's problem.
Well, like you said, a lot of them have the mental health issues. They have to be dealt with as well.
Right.
They have to be counseled, they have to be treated.
I will, and once again, no expert on mental health, but politicians in general, especially Republicans, we deal with what? Tax cuts and budgets and dollars, right? I mean, dollars and cents typically. And to his credit, our Speaker Voss has allowed me to and empowered me to work on this issue and be able to have the bully pulpit to do it. But we're also at the same time, Speaker's Task Force on Mental Health is actually working right now too, and these are issues that are very controversial, but very relevant to our society. Things such as emergency detention. We had the case down in southwest Wisconsin where the family tried to get the gentleman who was in crisis some immediate help, and the current bureaucracy didn't allow for it, and he ended up, I think, murdering 3 or 4 people. So it may not be acceptable to everyone that we have the ability to do an emergency detention, but who knows our people better than their families and their loved ones to see whether they're in crisis or not. And I think those are some reasonable steps that we're trying to take. But you know why truth in sentencing and lock them up and throw away the key has always been popular with politicians? Because it's typically been popular with the public. Yes, ma'am.
You spoke about 31,000 for man and 41 for female. What percentage of those in our prisons in the state of Wisconsin are there for drug-related offenses?
You know, I don't know the numbers. You guys know the numbers at all? It's significant. I'm sorry?
I know it's high.
It's a significant percentage of it.
Federal prison is far higher than state, and state prison is, I mean, people say the majority of people are in there for drug offenses, but federal prison is highly populated with drug offenders. State prisons is
I will say, I know my own county pretty well. Marin County Jail was built 9 years ago for double occupancy of what their need was. Okay, today it is filled, and it's filled not just with drug offenders, but if you went through the census of the people in the county jail, there are 95% of them are there because of drugs, armed robberies, burglaries, frauds. You name it, they're there because of drugs. So I think the percentage is quite high. The crime may not be specifically drugs, but there's a lot of, you need to feed the habit, so you're doing whatever you have to do. A lot of desperation that creates other crimes. Yes, sir.
Representative, I hate to ask this question because I know it's probably an impossible one, but I will anyway. What do we do to prevent the person from taking this stuff the first time?
You know, I think if we knew that answer, we wouldn't be here. I guess I just go back to our culture, especially with prescription drugs. And I haven't talked about this yet, but I had the Pharmacy Society in today. I've had Medical Society in. We need to change our culture. We need to change the access to the prescription drugs so that it's not as readily supplied as it is. John Nygren opinion and mine alone, but I'm 49 years old. When I grew up, the people I was around, there were good kids and there were naughty kids. Someday I was the good kid, someday I was the naughty kid, right? I mean, that's just the way things were based on which side of the bed I got up out of. Well, today, I swear that our attitude is, if our kids are too rambunctious, there must be a medical reason for it. And the percentage of kids that are on Ritalin or Adderall or some type of medication, in my private life, I do health insurance. So the number of young people that are on some type of antidepressant is shocking to me. So my reason I'm saying this is we're teaching our young people that if they have a struggle, that there's a drug for that. that there's a pill for that. So the step to prescription drug abuse, is it really all that far? I don't think so. I mean, the doctor sends me home from a pulled muscle with a 30 count of hydrocodone. I take one and I'm blooped. So I never take them again. But I go back, and what happens? He prescribes them again the next time I hurt something. And I should say no, but I didn't. So I guess we need to just change that perception that there's always going to be a pill to make us feel better. And I'm especially with young people, when we do that, what are we teaching them? The next time when they have a struggle at school or whatever, there's a way out, and it's through popping a pill. I can see that addiction being a lot less scary than putting a needle in my arm. But that's where it starts. The addiction starts there, and then they have the craving and the need to go to continue it. And when their source dries up, the heroin is, I guess, not such a big step. So I just think society needs to address the problem of prescription drugs and prescription drug abuse. That's probably the most likely way to deal with the problem. Anybody else? Yes.
Just any thoughts on the change in mandatory sentences, like 5 grams of cocaine will get you 10 years and that kind of stuff?
We're not talking about that, but I will say I think that it's coming around. I do believe that those conversations will be taking place, because it's not, once again, not delivering on the results that we thought it would. Okay.
I'll just chime in and on that note. Well, 23 years ago, when I worked for the Department of Corrections, I got to work on what was then a pilot program of the intensive sanctions. That was when they put the bracelet on you to monitor where you are. It was just a tiny pilot program that we were trying out. And then later on, a couple of years later, I came back to the Department of Corrections as a budget analyst, and worked both with probation and parole, and then what had become the Division of Intensive Sanctions. And spent time with field agents, and when you spend time with a probation and parole agent, they maybe see their client twice a month to a time where they see them once every 6 months. And with intensive sanctions, when you were monitoring them with a bracelet, you were seeing them 1 and 2 times a week, and you were going through it, and if you sat through it, you were coaching these people. This was in one I rode with was in Madison. So the person, he said, "Did you apply for that dishwasher job we talked about at Qdoba out by the mall?" And he said, "Yes, I did." And then he said to him, "Did you go next door and apply at the Red Lobster?" And you could just see on the guy's face, he didn't even think of it. It wasn't, he would have never thought of it had there not been an agent there to tell him to do that or to bring that to. And so when these people, and this is going to be tough to bring these programs back into the communities. There's going to be a lot of, not in my backyard, are we going to do this? But there needs to be some way that we help these people readjust in the communities. And probation and parole has not been a great model. I think intensive sanctions is a better model, but it's a much more costly model. But it's less than prison.
Question?
My question was, is there any successful treatment?
Treatment, treatment tends to have, at least what I've read, between 35 and 40% success ratio compared, so it's not a magic, there's no magic wand that says if we send them to treatment, it's going to work every time. I think the average is, I think 2 point sometimes in treatment is the average. And I guess with my attitude, I know that's like, how can you fail at that, But when you've got that addiction and you see it over and over again, it's pretty consistent that it takes a couple times at least for that person to be able to register with them. And my personal opinion is I think they have to want to. I mean, they have to be at that point. We can't want it enough for them. But from a dollars and cents standpoint, once again, it still makes more sense to try that at 30 to 40% success than what we're doing right now.
I don't know what is it? I mean, can you use like methadone and Suboxone for heroin, or is it mostly intense counseling, or are there, drugs
to help you?
The answer is yes, there's all of those things. There's methadone treatments, there's Suboxone treatments, there's something called Vivitrol, which Vivitrol, from my understanding, is it blocks the ability for you to get any type of high whatsoever from the heroin, but it's quite expensive. It's about $1,000 a month.
Well, it sounds like what he's saying is that they could do some mentoring.
Yes.
What, all along and at the end and all along.
I think it's different from case to case, but I know in my daughter's situation, you would think being around your family and being around the people that care about you is probably the best thing for you. I actually think in her case, she needs to go away from the environment that has empowered, and I'm not saying necessarily us per se, but Marinette's a small community. It's 12,000 people. Everybody knows everybody for the most part. So you can't go into back home and stay away from the cycle of friends that brought you to where you've been.
They can't get jobs when they get out of jail because of their history.
Well, I mean, that we're having that discussion too, quite not, because there's something that's called a proposal that's called ban the box, and the box on it. What that means is on the application there's a box that says, "Are you a convicted felon?" And in most cases, you check that box, your chances of getting an interview are pretty slim. However, I will say, and I've had employers tell me this, there's employers that have had pretty good success with recovered addicts because they're happy for that second chance. So we're having these discussions. None of these are easy because for every person like you who might think that's a good idea, there's several others who may think that's not a good idea.
Any idea on the difference in cost? I believe for Marathon County, we spent about $145,000 for an OWI court. How much would it cost for a drug court? Any idea?
Do you know the numbers?
I want to say that they were talking to start up our drug court was going to be $500,000. So, but again, we just had real preliminary discussion.
And here's the issue. We've talked about this already today, but here's the issue with that. When I look at these, when we putting together the budget for the state or putting the county budget together, we look at the cost now. We're not allowed to do what, at least at the state level, what's called dynamic scoring and say, okay, if we do X, we save Y and Z. We're not allowed to do that. But that's true. I mean, the numbers will prove it out. If we spend more money on drug courts, and Swift and Certain and these other things, we'll save money in other areas, but it's an unknown at this point in time. So for us, by putting money into these programs, our budgets are going to go up. So that's just the challenge we face, is because it's an unknown of what kind of results we're going to get. Any other questions? Okay, well, we were right about on schedule, I think. I appreciate the opportunity to be here. We're going to continue this discussion through this remainder of this session, and I don't expect it to be over. I expect it to be a topic that we'll be facing for several more sessions. And if you've got ideas, if you've got folks that want to participate in building a coalition to fight this problem. I know Wausau is pretty active. Marathon County is pretty active. I'm sure they're always looking for more people to help out. I thank Keene for getting me here. Known Keene for many years through our involvement in JCs and now in the Republican Party and Center-Right Coalition. Could use more people like Keene working with me down in Madison. So anytime he calls, I have to help and have to listen. So thanks for putting this on, Keene. So appreciate it. With that, thank you very much for the opportunity.